Good evening and welcome to The Big Fight, a show that is young at 21, the oldest running debate show on Indian news television. I'm Sanket. When vaccines were cleared for use earlier this year, statements by the Health Minister, Dr. Harshvardhan, to NDTV, where he said that this is the beginning of the end of COVID-19, made a lot of sense, so much sense. We were filled with positivity. It felt that finally the difficult phase of our lives is now going to be over. The vaccine was rolled out to emergency frontline warriors like doctors, cops, and then we waited for very, very long before it opened up for the elderly. Even then, the government maintained that this is the beginning of the end of the virus. The assessment was largely believable because the All India cases were less than 10,000. But steadily, these cases have started increasing again. Perhaps a lesson or two should have been learnt from countries like the United Kingdom, who introduced the vaccines yet imposed lockdowns because of new mutations and strains. We are now in a situation where vaccination is on, but cases are rising sharply, almost the August-September 2020 levels. Same pain points, same areas, same problems, it seems, all over again. But the idea of this program, ladies and gentlemen, is to not criticize or point fingers, but to exploit the only solution we have with us, the vaccine. A simple question on The Big Fight today. It is not too late even now. We have delayed it, but we can still do it. Why can we not have jabs for all? That is going to be our discussion right now on The Big Fight. The second wave, time to allow jabs for all. Before we move any further, let me now quickly show you why we feel that jabs for all is the need of the hour. You look at the average daily deaths that are rising sharply and how the average daily cases are also rising. So this is the 15th of February, right? You can see cases were around 10,000, a little over 10,000. 17th increased marginally, 19th, 21, 23rd, 25th, and then we reach March. You see an upward trajectory. Now this should have been reason enough for us to worry. This should have been that point where we should have really, within the system, thought to ourselves, now is the time to open up the vaccination process. See, the deaths also saw a surge around this point. And then, now we are in a situation where around the 15th, 16th and 19th of March, you see this rise and also a sharp increase in the number of deaths that have been reported. You see no sign of this coming down. There is no sign. It's only going up. And that's the reason, that's the cause of worry. This is the big reason for worry. Let's now quickly take a look at India's positivity rate, which has also increased sharply in the past 4 weeks. The purpose behind this data is not to spread panic. The purpose behind it is to build an argument that we need vaccines for all. You look at 4 weeks ago, where our positivity rate was 1.8%. This, by the way, is a 7-day moving average. 2 weeks ago, it increased to 2.1. 1 week ago, it was 2.7%. And now, on 19th of March, we are at 3.2%. 3.2%. 4 weeks ago at 1.8, now at 3.2%. And this is rising sharply, as you can see. Big reason to worry. Big reason. Let's take a look at where we stand when we compare ourselves to the world. And this too is an alarming figure. We are rising at a faster pace than the United States and the United Kingdom. The figures are right here. The percentage increase based on a 7-day moving average in the United Kingdom is 0.1%. That in the United States is 0.2%. That in our country is 0.3%, which is not good. Again, the purpose behind all of this you've got states, the 8 states where the cases are surging. I mean, this is a lot of data which you will see through the course of this broadcast. In Maharashtra, a big perpetual problem, the state of Maharashtra, where you see the cases constantly high, rising in Tamil Nadu, rising in Madhya Pradesh, rising in Punjab. This is all information from the PIB, which is the government. Rising now sharply in Delhi, rising in Gujarat, rising in Haryana, rising in Karnataka, just going on and on and on, which brings us to the all-important question all over again, and that appears on your screen once again. Let's talk the solution. The purpose behind giving you this data was to eventually arrive at the point that we have that solution with us. Time to allow jabs for all. That's the only thing that can save us, ladies and gentlemen. Okay, Dr. Randeep Guleria, Director of the All India Institute of Medical Sciences, is now with us. Dr. Guleria, good evening. We've been speaking regularly. I want to ask you directly, what stops us, Dr. Guleria, from exploiting this big weapon that we have to arrest COVID-19?
So I agree with you that we have a big weapon. I mean, this is one of the weapons that we have. COVID appropriate behavior is the other, and the whole strategy of testing, tracking and isolating is the third one that we have as far as the current spike in the number of cases is concerned. But the new weapon that we have is vaccination. And in an ideal situation, one would like to vaccinate everyone if we could. But even if you look at the adult population of our country, and we would say that we would like to vaccinate the entire adult population of India, we are looking at vaccinating a little less than 1 billion people. And that means we will need 2 billion doses, because there are going to be 2 doses that we need to give. We don't have that. I don't think that's available even globally if we needed to do that. And therefore, we will have to do it in a phased manner. And the only way one can do it in a phased manner is trying to see how many doses do we have per month and how many can we vaccinate. If we have enough doses to be able to vaccinate more people, we should be able to vaccinate more and more and be able to really optimize the number of doses we have and the number of people we vaccinate. To do that, we need to have good vaccination centers, a good coordination. But I think if we have enough capacity, we should lower it down to the other priority list, less than, let's say, up to 50 years or even less than 50 years, because they are the ones who would have a higher death rate because of COVID-19. But we have to look at the supply and demand issue, that has to be balanced. If we were to really vaccinate a large number of people at the first end and did not have enough doses for the booster shot, that itself would also create a lot of issues in terms of new variants emerging, because of the fact that everyone would not have enough immunity to be protected. And if they got COVID-19, we could really have a new variant emerging as a part of an immune escape mechanism. Therefore, we should have enough doses. If we have enough doses, the best strategy would be to vaccinate as many as we can.
But Dr. Guleria, surely the government knew, and I know a lot of time has gone into planning the rollout of the vaccination process. The government knew that we have a large population to vaccinate, right? The government also knew that we have to build a system in place. And yet, we are here where we are talking about a demand and supply, possible demand and supply problem. Do you think that, this was a challenge that could have been seen earlier, predicted and fixed?
I don't think so, because we must understand, we are looking at vaccinating adults, which has not been done in the past, and vaccinating all the entire adult population. India in the past has been doing a very robust vaccination program, the Universal Immunization Program, which is basically for children and pregnant women, which is only around 4 to 5 crore per year. Now we are looking at, like I said, 1 billion people. We will not have enough manufacturing capacity for 1 billion people. No country has it. Even if you look at the manufacturing capacity of a country like the United States or the United Kingdom, they cannot at this point in time have enough manufacturing capacity for so many doses. In the UK also, they're relying on other countries to provide them the vaccination. And the same is happening as far as the US is concerned. So our population is so much that we will need to have a graded approach rather than saying that we will overnight vaccinate everyone. Even if we had the capacity to do that in terms of infrastructure, we will never be able to have that many doses. And therefore, I think we have to develop a graded strategy. And that is why I keep emphasizing that although vaccine is very important, unless we also combine this with COVID appropriate behavior, people have started believing that now the vaccine is available, I don't need to wear a mask, I don't need to have physical distancing, I can have a big party and no one needs to wear a mask in that party. If we continue to do that, the vaccine itself will not be effective. And this is something that we're seeing globally. And therefore, if we are really going to get this peak down, if we're going to get this surge down, we need to ramp up vaccination, but we need to very aggressively work on COVID appropriate behavior. People need to understand their responsibility, the social responsibility, and we need to go back on what we were doing 6 months ago in terms of aggressive testing, tracking, isolating, making micro containment zones so that we don't let the infection spread to other parts of the country.
Correct. Correct. Dr. Guleria, you know, the government set itself an ambitious 6-month target where it said that it is going to vaccinate at least the vulnerable section of the population, the elderly, the frontline workers, right? Now we see that about 130 odd days are left in that 6-month target. And we are growing at a certain pace in terms of vaccination, but we are not vaccinating enough. So roughly we have a target of 27 to 30 crore of our population to vaccinate, and we have about 130 odd days to go. So the speed at which we'll have to vaccinate will be, see, it's like cricket. The run rate is going to keep increasing. So do you think that this is going to be a big challenge, and thus a misappropriation of our calculations?
So you're right. It's like a cricket match, and we need to really do a lot of catching up, hit a number of sixes if you really need to get the run rate down. And to do that, we need to open more centers. We need to have a strategy. We are gradually coming to almost 5 million vaccinations being done per day. We would like it to be up to 6 to 7 million a day, and gradually try and increase it as much as we can. I do agree that there is a need that we need to really have more and more vaccinations per day, because unless we do that, we'll not be able to reach the target, and then we'll have a lot of problem when we come to the last over.
No, yes, Dr. Guleria, and since we are talking in cricket terminology, which this country totally understands, you say that we are vaccinating around 2 to 3 lakh people a day. That's the pace at which we are vaccinating right now. This
3
has
million a day.
Sorry?
We're doing 3 million a day.
3 million, right. We are doing 3 million a day, but we have to do far more. This has to increase at a really sharp pace. Almost 20 lakh a day. Almost 18 to 20 lakh a day. So do you feel that a very strong initiative needs to be taken, and who else will do it? The government will, to immediately increase the number of centers and also cut down vaccine wastage?
Correct. So I agree with that. We need to have more centers. We need to reach out to the vulnerable population so that they are not left. And we need to see how we can increase maybe the timing of the vaccination, more centers, so that we are able to do almost 5 to 6 million people vaccinated per day. If we can do that, or even ramp it up to a larger number, it would be easier for us to really achieve the target and have a few overs to spare. So if we can do that, that would be something ideal, but it's a big challenge. And I think there has to be involvement of everyone. People need to come out and get themselves vaccinated. There is still a lot of vaccine hesitancy in a large number of people. We also need to develop more centers. We also need to reach out to those who are not tech savvy so that they can also come and get themselves vaccinated. And this is very important in rural India and in smaller towns and cities. If we are able to do that, and we are confident that we have now reached a reasonable number, that we have been able to vaccinate majority of our, let's say, over the 60 age group people, we can then lower it to, let's say, 50 years and above or 40 years and above. And that way keep on increasing numbers so that the number of people who are getting vaccinated become more and more. Because we're trying to achieve two things. One is save lives, bring down the mortality. So those with comorbidities and who are at high risk because of their age are vaccinated. And secondly, have a large number of people who have the immunity, and therefore they break the chain of transmission, and therefore viral replication comes down, number of cases come down, and we need to do that as early as possible.
All right, Dr. Guleria, many thanks for joining us. Let's hope that our viewers as well as people understand the cricket terminology at least to be able to save themselves and their family. Thank you very much, Dr. Guleria, for joining us.
Thank you very much.
All right, let's open this up for a discussion. We've got Professor Sanjeev Krishna, who's a professor of molecular parasitology and medicine. He joins us from the St. George's University of London. We also have Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospital Group. Dr. Shahid Jamil, he's the Director of the Trivedi School of Biosciences at the Ashoka University. Thank you very much to all of you all. Dr. Reddy, you just heard what Dr. Guleria had to say. We are vaccinating, but we are not vaccinating enough. We have to vaccinate faster because this is the strongest weapon that we have as of this moment. What do you think could be the likely problem, and what is the possible solution that you would offer?
So, Sanket, I think all of us are in agreement that we need to enhance the number of people who are getting vaccinated every day. I will slightly move away from your cricket analogy because unlike in cricket where they're just two teams playing and the spectators are truly spectators, here the scenario is entirely reversed. You need the population to come forward and get vaccinated. And that's where the whole crux of the situation is lying right now. Because you have centers available, you have vaccines available, but they're not seeing the kind of rush that we saw in the first 2 weeks. And therefore, number one, we need to enhance communication about the safety and the efficacy of the vaccine. Number two, communication about the fact that even after having the vaccine, you have to continue to be careful. Because while you may not get COVID yourself, you could continue to be a carrier and put the community at risk. And that is an important part of communication. So SMS, very clearly sanitize, mask and social distancing have to remain the norm. The next aspect, which I think is very important, is that as we keep tracking and monitoring the supply versus the ratio of number of people, you keep opening up the category of people so that you can enhance and move towards mass vaccination in the quickest possible time. So right now, it's a combination of public communication, increasing the number of centers, vaccinating as quickly as we can. But the fact is that everybody knows this. The government knows this, and they are calibrating their supplies to make sure that as many people as possible take it. So the biggest messaging I would give this evening is really to public watching the show, saying those who are in the category who are eligible for vaccines, please come forward and take them. And those who have already taken your vaccine, please make sure you follow the norms. And even more especially so, those who have not taken the vaccine, your safety norms are critical. There is a general kind of slackening of behavior across the community.
True.
And things like festivals and elections have not helped. So it's very important for public to once again take the front line and protect themselves and therefore the community.
Yes. Professor Krishna, I want to come to you now. Globally, if you could just tell our viewers what really has been the model that has been followed. Because in India, we may be talking about vaccines being available and then for a very long time not being available to all, a long gestation period before it is being supplied and rolled out into the market. But what really has been the global experience?
Thank you for having me back. The global experience broadly is to be effective, you need to go in early and you need to go in hard and you need to use all the tools that are available. And as the tools become available, as for example, vaccines, you incorporate them into the overall management structure for trying to press down on this infection. Because coming back to your cricket analogy, you can't take your eye off the ball on this one. Really, any form of relaxation without full management, we've seen now allows this virus to escape. And we're seeing this escape now in countries in Europe, Poland, Hungary, Czechia, Czech Republic, and so on. You know, we really are seeing that things can take off very, very quickly. Now, we're fortunate that the vaccines and vaccinations have come on board, and they really are amazing weapons. But as everyone has already said, They are only part of the toolkit. And along with that, when it comes to vaccinations, there are some mountains still to climb. There's the messaging mountain. People are getting mixed messages about the safety of the vaccinations. And I think, to be honest, for example, the AstraZeneca Oxford vaccine has had mixed messaging right from the start, from even the manufacturers. And really, I think this message should be clarified much more now, because as complications mount and are recognized and are addressed, that this vaccine is still safe, it is still worth using. Please use it to protect yourself and to protect the community. As this message goes out, there still has to be some better way of overcoming vaccine hesitancy, which again, everyone is discussing as being one of the barriers to uptake. So we have a big toolkit. We need to put it all into action as effectively as possible, and we mustn't slacken on the general measures of COVID-appropriate behavior.
Yes. Dr. Jamil, it's interesting that everyone seems to be saying that vaccine or no vaccine, COVID-appropriate behavior cannot be taken lightly. It's not like you got a jab and then off goes the mask and everything is fine. No, it's not. Dr. Jamil, I want to come back to the required pace of vaccination. I asked this question of Dr. Guleria also. Even now that we are vaccinating about 18 odd lakh a day, we are still behind our existing record, right? Our existing rate. Now we are talking about more people being vaccinated, whereas we are still behind our existing targets.
Yeah, so Sanket, a couple of points. Firstly, let me come back to the cricket terminology and say that India is very good at chasing targets. Now, having said that, vaccine is only one tool to curb the pandemic. Vaccines take time to show their effect. From the time you get the first shot in your arm, it takes you about 45 days or 15 days after the second shot to be fully protected. And we must also realize that everyone doesn't raise the same level of immunity. Some people raise much better immunity than others. On the other hand, if you are following COVID-appropriate behavior, if you're wearing masks, if everyone wears a mask, then you cut down the transmission to only about 5%. So I don't understand why this simple message can't get across that vaccine is not a panacea for all our problems. Vaccine is one tool. We can't put all our eggs in the vaccine basket and go around with irresponsible behavior doing everything that we are doing. That's point number one. The second point is that India over the past 1 week has been delivering 2.5 to 3 million doses. That is 25 to 30 lakh doses per day. Now, yes, the rate needs to increase, but the rate also has to match supply. There are only 2 vaccines that are licensed for use in India. If there were 5 vaccines, we wouldn't really be having this discussion. So I think it's equally important that just like Covaxin and Covishield were given emergency approval because Covishield was approved elsewhere.
Yeah.
You have the Johnson & Johnson vaccine, you have the Novavax vaccine, you have the Sputnik vaccine. We should really be deploying those as well to increase capacity. Because after all, Serum Institute and Bharat Biotech, whatever their capacity is known. They are increasing their capacity, but all that takes time. So that's another dimension I would add to the solution.
So faster rate of vaccination, and after following all procedure, clear more vaccines for use. For instance, Sputnik V.
Absolutely.
So you feel that
when Covishield was cleared for use in India, there was no phase 3 data from India. There still isn't. But 80% of vaccine that we are getting is Covishield.
Yeah.
The efficacy data came from studies in UK, South Africa, and Brazil. So why can't we do the same to the other vaccines?
Yes. Now, I really wonder why, what the government will have to answer to these questions, because these are absolutely pertinent, coming from the experts, and surely someone in the government must have thought of this. We'll try putting these questions to government representatives to ask them why this cannot be done, or what is the problem to have more vaccine candidates, approve more vaccine candidates post due deliberation. Thank you very much, Dr. Reddy, Professor Krishna, as well as Dr. Shahid Jamil for joining us in part 1 of the Big Fight. We're stopping for a short break at this moment. When we come back, we've heard of the international experiment or the experience. We've heard of what experts have to say. We'll now listen to what states in the country are saying. Remember, a lot of states are now urging the center, open up the vaccination process. What do they say, and what's the response that they've got? All that and much more after a short break. Welcome back. Before we go any further, I want you to take a look at this video. What has happened is that this video is from Mumbai, and this is what happened when a marshal stopped a lady and wanted to impose a fine for not wearing a mask. Listen in. That was a marshal. She stopped this lady, wanted to impose a fine. Remember, this is Mumbai, this is Maharashtra, where this state has consistently seen high number of COVID cases. They wanted to impose a fine, and this is what the marshals got in return. These people who, number one, are defaulters, and then number two, who behave like this, are far away from COVID appropriate behavior. And they are the problem, not part of the problem, the problem. And this is why we are seeing an uptick once again. No amount of vaccine will be able to help if we don't have a change in this attitude. There was a reason why we paused and let you watch this picture, because this is the picture which defines very, very clearly the problem that we are facing as of this moment. But what really are the demands of the states as far as vaccination is concerned? COVID appropriate behavior and educating people on the importance is a different chapter. But on vaccination, where do the states stand? I would like to introduce Dr. Rahul Pandit. He's a member of the Maharashtra COVID Task Force. He is with us. We also have Dr. Mohammad Ashil, Executive Director of the Kerala Social Security Mission, and also the core team member of the COVID control in the state. We also have Dr. Rahul Sharma, Director and Head of Department of Pulmonary and Critical Care at Lickrest Hospital in Ghaziabad. Thank you very much to all of you all. In just a short moment, we'll have Dr. Arun Mitra as well. Dr. Pandit, let's begin with you first. Yes, of course, you have a problem on, of COVID appropriate behavior. This is a big, big challenge always and all the time, and will continue to remain so, right? You can't change people overnight, or you just can't change people sometimes. But the point, Dr. Pandit, is in terms of vaccination, what really is the demand that a state like Maharashtra is going to place? Before I go to Dr. Pandit, I believe we've lost that connection on him. Let me ask this question of Dr. Sharma. Dr. Sharma, I'm sure COVID appropriate behavior is a problem in Uttar Pradesh also. I'm sure these are similar problems people face everywhere. I want to know from you, vaccine being a tool available to one and all, how appropriately should it be used? What's your reading?
So I think these are two most important questions that we need to address. One is the COVID appropriate behavior and the other one is vaccination. So we need to keep this in mind that vaccination is not 100% preventive. It has some limitation and it is not widespread spread in India till now. The coverage is still very, very less. So COVID appropriate behavior is the only way right now when we are seeing that so many patients and so many vaccine, till the time it covers at least 70-80% of the population, you need to have this COVID appropriate behavior. It is not like that some people are getting vaccine and everybody is getting relaxed that yes, the vaccine has arrived and we are safe. This behavior has to be changed. We need to see that everywhere the cases are rising just because of one reason, that we are not following COVID appropriate behavior. You have already shown in that picture that people are so adamant, people are so reluctant to use even a single mask, despite we have seen so many mortalities.
Dr. Sharma, fine. I mean, people, yeah, you have to get people to follow COVID appropriate behavior. But you know, the other point also is, say, in a state like Uttar Pradesh, from where you have your hospital, is that the Prime Minister, no less, pointed out two faults, right? Fault number one is lack of adequate testing or the correct and appropriate testing, which is the RT-PCR. UP still largely goes with rapid antigen test. And then secondly is vaccine wastage. I mean, it's just criminal to think that a scarce commodity like the vaccine, which is so scarce, is also being wasted. 17%, in the case of UP around 10%.
I think these are again important questions. As far as testing is concerned, we are telling it repeatedly that since the COVID has started in India or in the world, testing is the most important and sole criteria to identify cases early, because most of the patients are still asymptomatic and they are probably the people who are spreading this disease.
Sure.
As far as vaccine is concerned, it is again a very, very important commodity, which we probably is the most important thing we were in the last 1 year, and it has to be used appropriately. I would like to mention one thing here. Since it is in a rollout phase where health workers were given vaccine first, and now it is for above 60 and 45 plus the comorbidities. Yeah. But I think it has to be rapidly spread to each and every person who wants to get this vaccination, because this is not the way. When our cases are rising, I think everybody should have liberty to go and get himself vaccinated.
Okay, Dr. Pandit.
Only it will.
Absolutely, that way it will get under control. But the government says, and representatives say that, you know, we've got a demand and supply situation to match, and that's the real problem. Dr. Pandit, I want to come back to you now. You know, you are part of the Maharashtra COVID task force. This is one state which has always been the biggest challenge, and also has fought the COVID-19 most, far more than any other state. Now, what do you think as far as vaccination is concerned? COVID appropriate behavior we've discussed enough. It needs to be there. But in terms of vaccination, what needs to be done, Dr. Pandit?
Thank you very much for having me on the show, and I'm sorry there was some technical glitch.
Not a problem, sir.
Look, I think the problem here is that we have to run both the programs parallelly. So vaccination program needs to be opened up. Right now, the demographic which we are actually vaccinating, 60 plus and 45 with comorbidities, is definitely going to save the lives, because we know that if you look at the mortalities, 80% of the patients actually fall into this category. But to break the chain, we need to vaccinate those people who are actually stepping out of the house right now. And it's not the 60 plus who are stepping out of the house. It is the people who are younger, maybe from 20 to 50 years of age, who are actually venturing out of the house, going for their work. Not that they're going out for fun, but they're going out for their work, and that's where the COVID appropriate behavior is also low. We need to open up the vaccination pretty quickly, ramp it up. I know there may be problems with the dosage availability and the rest of the infrastructure being put up, but I think we need to ramp it up to a point where we can actually vaccinate both the groups so that we can break the chain, at the same time save the life. That's one thing. The second thing is we need to make vaccine accessible. We need to be making it accessible to the doorstep. You know, people right now have to come to a hospital, stand in a queue, If we can set up vaccination centers or booths or mobile vans with some, like an ambulance with an ICU facility in that, which has got a resuscitation bay in there, in each and every corner of the state or the city, people will walk in very quickly and there won't be any crowd as well on a particular center. Plus the rural area we need to think of. Maharashtra, the problem this time is that a lot of people are actually positive in the rural area. How much is the penetration in the rural area of vaccine awareness? That needs to be also taken into consideration. We have a good pediatric vaccination program going on, and that is what we need to basically rely on. We need to go on the same principles, and the pediatric vaccination program is go home and vaccinate, which may not be practical now, but go to the mohalla, go to the community, go to the village panchayat office, set up a makeshift vaccination camp with the bare minimum facilities which the government has mandated, and actually vaccinate people. I think that's what we need to do.
Okay. Dr. Ashil, let's listen to your experience also and your suggestions. You're the Executive Director of the Kerala Social Security Mission and also part of the COVID control team member. You're a core team member. Kerala has also been one of those states that has seen high COVID numbers. What do you think needs to be done as far as vaccination is concerned? Apart from the fact that, see, now that you know that the government's main concern is that we don't have enough vaccines. If we open it up for all, there'll be a shortage. And then there'll be a very, very difficult situation. So then, what are the solutions?
Let's go by numbers. Actually, what's the strategy of India per se in dealing with COVID-19? The vaccination policy is that not like many other countries, we are really going for creating a herd immunity through vaccination. As Dr. Rahul Pandit sir has clearly mentioned, what is the strategy India has adopted is that we are focusing on the people who are potentially more risky, more chance of dying due to COVID-19, or people who are at more risk. That's the people whom we are targeting at. Even if you go by that target, we have a target of around 30 crore people whom to be vaccinated before July 31st. That was our target. So if you look at if you have to vaccinate 30 crore people before July 31st, we must be vaccinating at least 30 lakh people per day. So if you look at the figures in India, it's coming around 17 lakh people per day as of now. And however, we have touched that 30 lakh mark on Monday of this week. Actually, on 15th, we have touched that 30 lakh mark. But after that, we have actually come down. And if you look at now, it's around 17 to 18 lakh per day is the number of vaccinations which is happening in pan India. If you look at, as clearly mentioned by Rahul Pandit sir, the strategy here is that we have been actually, the vaccination sites, if you look at, there are around 41,000 vaccination sites, of which only 6,000 is in the private sector. So if we have to decentralize this entire system, the states must be given enough freedom to do that. Actually, we have enough legacy of doing kind of a polio vaccination. We have legacy of doing measles rubella vaccination. India has a good legacy.
No, do you think, Dr. Ashil, see, the concern over here is that you cannot expect suddenly for those many vaccine vials or dosages being available just like that. It's not possible. The best of the facilities in the world cannot provide. So do you think that this is a concern which the government should have thought of in advance, perhaps planned better? I understand you can't just start manufacturing. There is a proper procedure in place. It takes many, many years. There has to be a proper system in place. But the fact that we are behind schedule on the existing vaccines is also a telling story and a point of concern.
Yeah, if you look at the stock of vaccine in India, to date, if you look at the stock of vaccine in India, we have enough vaccine to actually speed up. The Honorable Prime Minister's meeting day before yesterday also cleared that we have enough vaccines in stock to initially ramp up our vaccination campaign. The problem primarily I see is in the implementation part, not just in the stock. If you look at the stocks in India, we have actually said that we will not be exporting the vaccines till we have, as we have a shortage. So if you look at, there are many curbs of exporting of also now. So we may be having, there would be a small shortage, but I don't think that it is the primary factor which is actually stopping us from accelerating the campaign. Okay. The primary thing I would suggest is that, I would think is that, as Rahul sir has said, that the implementation part, it should be, enough freedom should be given. For example, we were actually in Kerala, we were trying to vaccinate entire people in the homes, like old age homes. Old age homes, the vaccination, initially with the vaccination, we thought of vaccinating every person. That we have 619 old age homes, of which there are 19,800 old age elderly. So we thought of vaccinating everyone. But the problem here is that many of the old people in old age home may not be having an ID card. But we need a photo ID card to be incorporated to get in the vaccines. So there are similar small things which small predicament at the administrative and managerial level, which can be entrusted on the states. For example, if you give a set of vaccines, say that if a state is given a set of vaccines, the team in that state actually knows that how to actually do that. So I think though the mechanism of actually going through COVID software has many advantages, one primary thing which is blocking the pace of the delivery is also the software part. We need to be actually doing a campaign when it should be the secondary thing. Like when the software should not drive a campaign. Campaign should be driven by the science of it.
Okay. Dr. Arun Mitra is also with us, Senior Vice President, Indian Doctors for Peace and Development, joins us from Punjab. Dr. Mitra, good evening. I want to ask you what according to you, could be the possible solutions to have jabs for all and soon? How can it be done? What are you hearing in Punjab?
See, firstly, I would say that Punjab is in a very peculiar situation. I am just coming from Tikri border, where we go every week to give medical aid to the farmers, and we have examined thousands of patients. People are living in tractor trolleys together with unknown people, and there is hardly any COVID to be seen. I have no answer to that. Even in the poor areas which are densely populated, you will hardly find COVID in Punjab. It's basically middle class and upper class disease in Punjab, at least. I don't know about other states. So the upper class and the middle class, they are now getting vaccinated themselves. Of course, the number is less so far. It has to be, people have to be convinced that vaccine will save their lives. They will not be, even if they are getting infected, they won't be so serious, or the fatality would be reduced. That only can help the middle class and the upper classes, economically, the upper classes to get vaccinated. They are accepting the vaccine by and large in Punjab,
no,
but
Dr.
we have
Mitra,
to do more. Yes.
Don't you think that this will automatically create, in terms of policy building, a sort of a class divide? That just because in rural parts of India you do not see, and this, by the way, the CSIR DG, Dr. Mande, it was his study. In his paper he said that it appears as if the parts where general hygiene standards were poor, people had greater immunity, and thus they were saved by this, they did not get the coronavirus. Don't you think that there has to be parity? So what if it is not spreading right now in rural areas? What if it does?
See, we have been having linear falls in September, and now there is sudden surge. Even the surge was expected in November and December also, but it did not happen. Whether it will happen in rural areas or in the poor areas, we do not know as yet. In fact, we should try to give vaccine to everyone. That is there. But the poor people or the rural people, they are not ready to accept. They say, where is the way?
Sure.
Where is the COVID amongst us? Where is the COVID? The domestic workers who come to our homes, whom we had forbidden earlier to enter our homes, fearing that they will carry the COVID infection to our houses, in the middle class houses. Now those women are saying, we have been carrying COVID from your house to our people. The reverse thing happened. This is a very strange phenomenon. But I agree that there has to be a parity in vaccination, but there is definitely a class divide. We may not see the class divide, but it is seen.
Sure,
that
the class division should not exist as far as policy formulation is concerned. It may or may not exist in the society. One really can't comment. But doctor, as long as governments don't divide on the basis of class, then I think we are in a good place. Dr. Pandit, very quickly, the last word. obviously we have to vaccinate everyone and we have to do it fast. I mean, you look at the way the figures are rising, it's very clear that there is a surge and we still haven't seen the second peak. It's coming, right? So what exactly needs to be done? We just a short while ago had experts who said that fine, have jabs for all, but also clear more vaccines. There are many vaccine candidates. So once you follow due diligence, the due process, then the drug controller can clear more vaccines.
Correct. Absolutely. I think we have many more vaccine candidates. The Sputnik vaccine is there. You have the Johnson & Johnson vaccine, which is basically going to be available. And you have the Pfizer and Moderna, which have got its own technical challenges in terms of infrastructure, which it requires for deep freezer refrigeration. But I think if we clear up more vaccine candidates and have the vaccines available, more doses will be available for people. And obviously the need for vaccination would be there. What I still feel is that we need to actually create more and more vaccine awareness. As you rightly said, that we are behind the schedule for the current one. And there are two reasons for that. We have not reached to the doorstep of the people to vaccinate, and we have not done enough yet to actually to promote the vaccination program, that everybody needs to do it. If you look at the queues in Mumbai city, and I can only talk about Mumbai city right now, it's the upper middle class and the middle class people who are queuing up at the centers. I'm not really seeing the same amount of enthusiasm in the lower strata of the society. And there is a vaccine hesitancy there, or there may be a bit of complacency that yes, it will come. We will just follow up. Why to go into a crowd right now? We will just wait and see. So that kind of attitude may also be there, but we need to do more to actually vaccinate.
Okay.
All three things need to be done.
Absolutely. Dr. Pandit, Dr. Ashil, Dr. Mitra, as well as Dr. Sharma, thank you very much for joining us. We come to the end of this part of The Big Fight, but news continues on the other side. Stay with us.